All right, it is now 1:30. Welcome back to the KFYR Plus News Desk. And pharmacies and pharmacists play a very critical role in our healthcare system. Now, they dispense prescription and over the counter medications and provide immunizations and counsel patients on medication, side effects, interactions, and even regimens. In an ideal world, everyone would have convenient access to necessary health services like pharmacies, but this is not the case. New data from GoodRx reveals that North Dakota is among the hardest hit states for pharmacy closures, leaving residents struggling to access essential medications. Joining me right now is Dr. Wynn, a health economist. Welcome to the program, Dr. Wynn. I appreciate your time.
Thank you for having me.
You got it. So, can you explain what a pharmacy desert is for some of the viewers who may not know and how it impacts their communities?
Yeah, definitely. I work on the GoodRx research team, and we track and report trends and disparities in the healthcare system, ultimately to help people better navigate their health. And we recently published some research on pharmacy access to assess whether people have adequate and convenient access to a nearby pharmacy. Do they have to drive very far to get to at least three pharmacies? And we found that 1 in 7 Americans now live in a pharmacy desert. And in North Dakota, 81% of the population, or 4 out of every 5 people, now lives in a pharmacy desert.
So, what factors are contributing to the rapid expansion of pharmacy deserts in this country?
So I think one of the biggest factors is pharmacy closures. In the past 5 years, we found that more than 1,300 pharmacies have closed across the US, and that leaves more than 48 million people without access to a nearby pharmacy. That's a significant increase from when we last ran this study in 2021 of more than 5 million more people living in a pharmacy desert.
How do these deserts now affect individuals' ability to access their medication and healthcare services?
So, retail pharmacies are really important for people not only to get their medications, but also get counseling from pharmacists and even get things like vaccinations and other services. And fewer pharmacies mean that people have to drive longer distances and longer drive times in order to get to the pharmacy. Not only that, but pharmacies are also going to be more impacted, the ones that are still open. So that means that could have a longer wait time when you get to the pharmacy counter. And those barriers to access are ultimately going to negatively affect people's experience at the pharmacy counter, make it more difficult for people to get their medications, and even affect their health outcomes.
How did the situation here in North Dakota compare to what other states are experiencing?
Yeah, so North Dakota is has the second highest rate of pharmacy deserts, right behind Alaska. So about 4 in 5 people live in a pharmacy desert. The other states that have high incidents of pharmacy deserts would be Montana, South Dakota, Nebraska, Kansas, and Wyoming. And there's a very high majority of population living far away from pharmacy deserts in these states.
What demographics are most affected by these pharmacy deserts and why?
So there's a lot of factors that go into what causes people to be living in pharmacy deserts. One of the biggest predictors of being in a pharmacy desert is being in a non-metro rural area.
Hmm.
Rural residents are especially affected because of a combination of factors, which kind of hits other demographics like older adults, senior citizens over 65 on Medicare, lower income individuals and families, uninsured adults, and as well as American Indian and Alaska Native residents. So a lot of these factors kind of come together, and that especially hits people living in rural areas.
Let's talk about the economics, Dr. Wynn. What are the implications of these pharmacy deserts, both on the individual and also on communities?
Yeah, so obviously on individuals, it's much more inconvenient to have to drive farther. The time that we're seeing people drive in rural areas can exceed over an hour and a half, which is, round trip. That's a very substantial co time cost. And in addition to the time cost, there's the cost of having to actually get there, spending on gas, rideshare, public transportation, just to get to the pharmacy to pick up your medication. On
Hmm.
top of that, not having many pharmacies to go to means that you can't price shop for your medication. So the price of your medication actually can depend on which pharmacy you go to. GoodRx is a platform that was started initially to help people compare prices and make sure they can get the best price for their medication. And so when you only have one or two pharmacies that you can get to and they're very far apart, that's going to limit your ability to price shop and find the best price for your medication. And that could even lead to people either spending more on their medication than they want to, or even skipping their medication altogether.
Do you have any solutions? What kind of solutions would you propose to address the growing issue of these pharmacy deserts?
Yeah, so, as pharmacies disappear, policymakers and healthcare professionals and communities will need to find new ways to ensure that people can get their medications. That could include expanding mail order pharmacy options or allowing pharmacists to provide a wider range of healthcare services, investing in telehealth. These are all potential solutions, but uh, the ultimate solution will need to be kind of tailor made to the community's needs and what's going on there.
As you mentioned, GoodRx has done extensive research. Is there any additional research that's needed to fully understand the impact of these pharmacy deserts on public health?
hmm Yeah, I think, as I mentioned, I think it's important to understand what barriers people are facing in their specific community and in their pharmacy desert to understand what would work best there. So, for example, I mentioned that a lot of pharmacy deserts are in rural areas, and those areas may not have good access to broadband, high-speed internet. So, telehealth, for example, might be more difficult to implement as a solution there than some other types of proposed solutions. So, I think ultimately more patient-centered research is really important to understand how to get people their medications even in pharmacy deserts.
Yeah, all right. We'll have to leave it there. Thank you so much for your insights and your expertise for us today. If the viewers would like to learn more or even get involved, where can they find that additional information, Dr. Wynn?
Yes, so to read more of our research and find more helpful articles to help you manage your health, you can visit goodrx.com.
All right. Thank you so much. Have yourself a great afternoon.
Thanks.
All right. It is 37 past the hour. Let's take a quick break here at the news desk, and we're back with more here on KFYR Plus.